Welcome to The Explainer. Today we're diving into the major new guidelines on blood pressure from the European Society of Cardiology. And look, these aren't just some minor tweaks. They really represent a massive shift in how we think about one of the most basic measures of our health.
Okay, so here's how we're going to break it all down. First, we'll get into the brand new philosophy on blood pressure itself. Then, we'll see why getting an accurate measurement is more critical than ever. After that, we'll look at how your personal risk profile totally changes the game. We'll cover the ambitious new treatment targets. And finally, we'll wrap up with what might be the most important piece of this whole puzzle: you.
All right, first up, let's talk about the most fundamental change. And honestly, it's not even about a specific number. It's a whole new way of looking at blood pressure.
So, the new guidelines kick things off by challenging a really basic idea that pretty much all of us have. For decades, we've thought about blood pressure in very simple terms. You either have high blood pressure or you don't, right?
Well, you can actually see the first clue right in the title of the guidelines themselves. It's a subtle change, but it's a big deal. They move from talking about just hypertension to managing elevated blood pressure and hypertension. That little word "and" tells us the focus is now on the entire spectrum of blood pressure that's above what's considered optimal, not just a single disease.
And this really gets to the heart of it. We're throwing out that old black and white normal versus high diagnosis. The new understanding is that your cardiovascular risk is a continuous thing. It goes up with every single point your blood pressure rises, starting from levels we used to think were totally fine.
I love this analogy. Your risk doesn't just suddenly appear when you cross some magic line in the sand, like 140/90. It's been slowly turning up like a dimmer switch, and that changes everything because it means we need to start paying attention a lot earlier. Okay, and that brings us to a really critical point. If we're going to act on these numbers sooner, we have to be absolutely positive that the numbers are right in the first place. So the new guidelines put a massive emphasis on this.
It might sound super obvious, right? But the guidelines point out that bad measurement technique is everywhere. And think about it. If that first number is off, then every single decision that follows, from lifestyle advice to starting medication, it's all built on shaky ground. So doing it the right way, every single time, is not optional. You've got to rest, be in the right position, and this is key. Take 3 readings and average the last 2. Why? Because that first reading is almost always a little high, from the stress of doing it. This simple little process gives you a much truer picture of your actual blood pressure.
The guidelines also really push for measuring your blood pressure outside of the doctor's office. And here's the crazy part. Notice how the number for a hypertension diagnosis is actually lower when you take it at home? That's to account for what they call the white coat effect, that little spike of anxiety we all get in a clinic. What really matters are your numbers in the real world.
So once we have a number we can actually trust, what's next? Well, the next huge step is to put that number into the context of your life. Your blood pressure reading is just the start of the story, not the whole thing. Now, this is a real game changer. It's a huge leap for personalized medicine. The guidelines are basically saying that a blood pressure of, say, 135/85 means something totally different for a healthy 30-year-old compared to a 60-year-old with other health issues. These risk modifiers help your doctor see the whole picture, and they can actually bump you into a higher risk category even with the same blood pressure reading.
And for the first time ever, there's a major focus on factors that are unique to women. A history of pregnancy complications, things like preeclampsia or gestational diabetes, is now officially seen as a major risk factor for heart disease later in life. This is a critical addition. And honestly, it's about time. And of course, there are plenty of other factors that apply to everybody. Things like your family history, your ethnic background, socioeconomic factors, even things like having a chronic inflammatory condition or a severe mental illness. All of this can change your personal risk. At the end of the day, it's about treating the whole person, not just a number on a screen.
So we've got an accurate number and a full picture of your personal risk. What do we actually do with all that info? This brings us to the new treatment goals. And this is where the rubber really meets the road. Things get a lot more specific and, frankly, a lot more ambitious. Okay, here it is, the big one. If you remember one thing from this whole explainer, let it be this number. For most adults being treated for high blood pressure, the new target for that top number, the systolic pressure, is this very tight range of 120 to 129. That's a huge drop from older targets, and it's based on powerful evidence that lower is better for preventing heart attacks and strokes. But, and this is a really big but, this isn't some rigid rule that gets forced on everyone.
The key phrase here is well tolerated. The goal is to get into that sweet spot without causing side effects like dizziness or feeling wiped out. It's an ambitious target for sure, but it has to be flexible for each person.
So, how do we get there? Well, the guidelines have actually simplified the whole process. Instead of the old way, starting one drug, waiting, upping the dose, the new recommendation for most people is to start with 2 different medications right away, often combined in a single pill. It just gets your blood pressure down to that goal faster and more effectively.
All right, that brings us to our final section, and you could argue it's the most important one of all, because all of these new rules, these numbers and targets, they're all designed to serve one ultimate principle.
You know, you go through hundreds of pages of super dense clinical science and recommendations. So what's the one theme that keeps popping up over and over and over again?
It's you, your goals, your lifestyle, your preferences, and your partnership with your doctor. The guidelines make it crystal clear that the old-school top-down doctor-knows-best approach just doesn't work anymore. It's outdated.
I mean, look at this direct quote from the guidelines themselves, an informed discussion tailored to the needs of a patient. What that means is these guidelines aren't a rule book for your doctor to enforce. They're a toolkit for a conversation between you and your doctor to figure out the best plan, the one that you'll actually stick with.
And that really leaves us with a fascinating question to chew on. Moving from a one-size-fits-all approach to one that actually considers our unique life story is a massive step forward. It just makes you wonder, what's next? As we learn more, how much more personal and tailored can our approach to lifelong health really get?